everybody. I'm Corinne Corbett, Editorial Director of Black Health Matters, and I have the pleasure of chatting with the one and only Raheem Devaughn about something special that he is doing this month as he embarks on an 18-city tour as he combines music and mission. And we are going to learn more about that. I want to start with asking you to tell us about your Love Life Foundation.
Well, Love Life Foundation has been established uh, since right around what's it 2013, 2012, 2013. 2014. We bet- between that span, the idea was conceived, and then you know I was already doing a plethora of community work anyway, so it just made sense for me to establish my own foundation at that point, where I could do more work hands on directly, support the initiatives I want supports, so forth and so on.
And what are the things that are important to you that you do through that foundation?
We do work in terms of HIV prevention. I've had previous partnerships in that sector. Uh, we feed people that are homeless and displaced as well. We provide scholarships, textbook scholarship. The textbook scholarship fund was created to support students for their first year of college, paying for books and supplies. We felt like that was something that was like practical that a lot of
Hmm.
times is overlooked for
Right.
students. We weren't in a position necessarily to you know pay tuition, full year rides and stuff of that nature just yet. But we still want to find a way to like be able to lend hands to to our local parents in the community as well as the students. So that was an initiative that we started out at the DMV. We would pick 3 students a year, and we've successfully sawn off a lot of students since then with the textbook scholarship fund. And then there's like toys for tots for of course the holidays and stuff like that. A lot of different initiatives. Uh, you know, One that I'm extremely proud of. Fighting domestic violence and
Hmm.
bringing more awareness to the community, to the Black community, and to the youth as well. Is being able to identify first of all what domestic violence is and understanding that it doesn't um, just affect women. Affects men, children as well. Teenage boys and girls as well. So being able to do a lot of work in that sector as well. Establish a program, the Queen for a Day Spa Takeover, which allows us to bring in women and pamper them for the day and let them know
Yeah.
that there's still, men out here that care, in a community that cares, is here to, be of aid to them while they transitioning out of very severe domestic violence situations. So those are just a few of our initiatives.
Doing it in your community is really important to you, right?
Absolutely. I mean, every community, like, I touch many stages across the country and across the world. So, the premise is that I'm not looking to just go into the community or go into a city like Chicago and just take and keep it moving. I think the greatest gift that we can leave behind is the gift of love and community and activism and stuff of that nature. So touring makes it very easy for me to move around and be part of the process.
Great, great. So, how did you start partnering with Gilead Scientists?
This is a new partnership, you know, uh, for Raheem Devaughn in terms of me,
Hmm.
in terms of branding, but also uh, allow me to, work outside of the sector of, the Love Life Foundation.
Hmm.
It just gives me an opportunity to do even more work. You know, being as that I'm on the Legacy Good Life tour, we feel like this would be a great time to mobilize and, have a strategic partnership. And, again, I think it made it very easy, me doing the work I've done in the past in terms of HIV awareness and prevention. Uh, you know, uh, Gilead felt like I was a perfect suitor uh, for the partnership, and I felt likewise as well.
Okay. So let's talk a little bit about what the partnership is and what you're going to be doing with Gilead
Yeah.
in terms of the the tour. So
Well,
you're on what you're doing in what you're doing. You're on the Let Us See Good Life tour, right? You're doing 18 cities.
yeah, I'm a supporter back on the Legacy Good Life tour. The tour has already
Mm-hmm.
started. We knee deep in it.
Mm-hmm.
You know, Gilead is showing up and showing out. Their local partners are showing up and showing out. You know, we're bringing awareness. You know, the goal is you know is to successfully. I'm hoping that we'll touch with 35,000 women. Within 30 days. This is a life changing experience. Providing information that'll save lives.
Right.
Obviously, knowing the fact that Gilead has already created $12 million in grants and local initiatives to create awareness about HIV prevention, anti-stigma, health equity for women, Black women and girls in the United States. This is the movement. This is the new cool. This is the new narrative.
Right.
Uh, and they allow me to join them as a partner, and they're setting the pace initiative, which again, is over $12 million, invested into local organizations on the ground for HIV prevention.
So what other cities are you guys going to this month?
Oh man, I don't have the
The
schedule right
list.
in front of me. Yeah, I had a list right in front of me. Yeah, I'll be honest with you, it's like a blur.
Yeah, yeah, yeah. Because I
Yeah,
know that you wake up
yeah,
every day and you're like, "What city is this?" Right?
yeah. I'm currently home on a brief break. And
Hmm.
I know that we're in Birmingham tomorrow. We got Birmingham coming up. We have Houston coming up. St. Louis. Uh, There's L.A., Oakland, California, and I'm sure there's a few spots that I've already missed. We hit Washington D.C., Philly, started in Newark, New Jersey. We've been to Columbus, Ohio. We've been to Charlotte, North Carolina. We've been to Durham, North Carolina. You know, just to name a few.
Hmm.
Cities again. For me, I'm on for 18 cities. There are a few cities that I'm not participating on the tour. But I mean, the cool thing about it is that I anticipate that this is just the beginning of a long, hopefully fruitful relationship. And you know you don't have to be on tour to care about people. Again,
No.
it makes it very easy to touch the people, knowing that I'm in these various cities every day, and we hit
Right.
the ground running. Me doing the meet and greets, and us and Gilead having partners come out, and we have us having the tables set up where they scan the QR code, do the survey. We get to have conversations. I can't tell you about how many people have pulled me aside when I'm in the merch line and thanking me for spreading the awareness, how HIV and AIDS has affected them, either directly or indirectly.
Right.
Um, yeah, so I see I see it working in real time. Absolutely, Black women make up for what was, I think it's only 14%.
Hmm.
Uh, you know, and they're half of the new cases and
Yeah.
you know diagnosis here in the States are Black women.
Right. Now walk me through. So how? So they're setting up like a meet and greet. How's it?
Well, yeah, it's I do a meet and greet anyway, at all the shows. It's
Okay.
something I've done since the beginning of my career. But we in a cool way we make it and able to get access to me. We ask that people scan the QR code before we get into the meeting and the greeting of things and taking photos and things of that nature. You know, we like to meet and greet with the people and test. Before I test the people, it's
Hmm.
it's imperative that they scan the QR code so that we can we can
Right.
get had the conversations and get them the information they need to have.
I think that's good. I think that's good. So I can, I'll just look up for the rest of the cities. I can get that information just so that people know, and we can share that on the site so that people know what other cities that the tour is going to.
Absolutely. And again, the mission doesn't stop with the tour. You know,
Hmm.
uh, I'm hoping that We continue our partnership, but it, this is something we
That's your
do.
work.
Yeah, this is my work. You know what I mean?
Right.
It's been my work for for so long. And obviously, it's so much work to be done. It's so much work to be done.
So, so what do you think that we need to do better in terms of getting the message out about HIV?
Um, I think that we're doing a great job. You know what I mean? What's the saying? It wasn't. House isn't built overnight. You got to do it.
Right.
You build it brick by brick and create the foundation.
Hmm.
Um, you know, I think part of it is just breaking down the stigmas and just making people, having people comfortable about having the conversations.
Right.
Um, I think also exploring preventative measures.
Right.
There's a there's medications and things that you can take now that's out
Right.
there
Prep.
as
Hmm.
well. PrEP, for example. You
Right.
know what I mean? Which is unfortunately for a long time it's been labeled as a gay drug, for example. You know what I mean? So just saying something or thinking something just as ignorant as that can create you know, uh, stigma, you know what I mean? So,
Right.
or stigmatization. So, yeah, it's awareness. Of course, obviously getting tested regularly. Knowing what's going on with your body, and I think just creating an environment, making a new cool, the level of comfortability between partners and human beings, having a conversation about what's going on with them. You know,
Yeah.
uh, yeah, I think that would help too. You know.
Yeah, I think so too. Do you think that um, that younger people are more comfortable and it is people of a certain age that are still stuck in fear?
I don't, I can't speak to that because
Okay.
I'm considered like a young OG at this point. You know what I
Okay.
mean? I, I, I will say this. I think we live in a time now, society where music and entertainment, for a lot of time, for far too long, you know, we haven't wanted to accept who we are in the community in terms of, I
Right.
guess, as role models or
Right.
leaders. you know. And I think that that definitely, in a time where music promotes promiscuous behavior a lot of times, or just the lyrics can be very reckless, and
Hmm.
and so forth and so on. For me, as somebody who I feel like has always made tasteful art, but let's be real and let's be blunt. I make records that speak to intimacy and sex,
Yes.
um, so I feel again I feel like from a branding standpoint it makes sense. If I'm making music about these things, what I'm saying, why not take it upon myself, to promote and talk about the importance of, sexual health and, the
Yeah.
responsibility that we have and that thing. It's almost like it's almost like the guy who has the liquor sponsor, right? And I'm not going to tell you to drink and drive. You
Right.
know what I mean?
Right.
So one of the terms I even use sometimes on a tour is just like it's sex responsibly. You know what I mean? Um, you know,
Right.
but also but
Absolutely.
also when you
Absolutely.
think about intimacy, intimacy is also more than sex. You know what I mean? So intimacy is conversation. You know what I'm saying? Intimacy is
Yes.
conversations and and hopefully establishing a level of trust and and a level of comfortability to want to have the conversations. You know what I mean?
Absolutely.
Encouraging, you know, whether it's my generation or or the youth. Um, um, you have people that are HIV positive, and then there's a movement out there where you can be HIV possible too. It's meaning like there's a possibility
Yes. Hmm.
that this could affect you or someone close to you that you love, you know? So again, you know, kudos and hats off to Gilead Sciences for, you know, stepping up, you know, and providing tools, you know, spending over $12 million. That's a lot of money, you know. Uh, and you know,
Yes, it
I'm
is.
proud to be part of the team.
All right. Well, thank you so much, Raheem,
Thank you so much.
taking the time.
All right.
I appreciate you.
Appreciate
Have
you
a
as
great
well.
night.
All right. Love life.
Great day. It's not even night, it's
I
a
know,
day.
right?
All
Peace and
right.
love. Peace and love.
Take care.
All right.
All right. Peace. Thank you. In order to find out more about Raheem Devon's unique partnership with Gilead Scientists, we decided to talk to Deborah Wayford. She's the Senior Director of Public Affairs, U.S. Virology, Community Engagement and Advocacy at Gilead Sciences, about the unique partnership that the two of them have, Gilead Sciences and Raheem Devon. Here's Deborah. So I have the pleasure of speaking with Deborah Wayford.
Hi, my name is Deborah Wayford, and I am Senior Director of Community Engagement, U.S. Virology at Gilead Sciences, and I'm happy to be here today.
Great, great. So I've always had the opportunity to talk with Raheem Devon about your partnership. And I wanted to dive deeper about your PACE program and your partnership with Raheem and how that came about.
Well, you know, it came about when we look at HIV in this country, and you look at HIV and Black women. Black women, of all women, are most impacted when it comes to HIV. And we were looking for an opportunity to educate Black women, not just about HIV, like they might be at risk for HIV, but Black women to help educate the community about HIV. And so the PACE program is a program where we're looking at arts and advocacy and how do you work through arts and advocacy to educate community, and especially the Black community, around HIV, AIDS, and prevention. You know, right now, there are a lot of people in the Black community who don't know that HIV can be prevented. And there are different ways that it can be prevented, right? We know that if people who are living with HIV are taking their medicines and they keep their virus suppressed, there's no virus to transmit, you know, so treatment is prevention. We know that if people think that they might have been exposed to HIV, they can get post-exposure prophylaxis. They can get medication after the exposure that could prevent transmission of the virus. And now we have PrEP, which is pre-exposure prophylaxis. And so through the PACE program, we wanted to empower women with information to educate the community, but also to educate other women about how we can prevent this virus transmission from person to person, especially Black women.
Right. So tell us what PACE stands for.
We're talking prevention, arts, advocacy, community, and education. I got it right. Prevention, arts, and advocacy, community education. That's what it's an initiative providing grant funding, and you know, through these partnerships with different organizations, we funded 19 organizations to help educate Black women and girls and trans women about HIV in the United States.
That's amazing. That's amazing. How long has it been around?
So we just launched this program this year in
This
20,
year.
yeah, just this year. It was launched
Okay.
this year.
Okay. So are
Mhm.
you working with other artists? I mean, is this the first partnership with Raheem? Has this the first music artist that you're working with?
Yeah, this is the first music artist that we're working with. I mean, Raheem Devaughn has been very committed and connected to the work that we're doing. And we're actually proud of the relationship and the partnership with him. I mean, I think one of the things that has happened in the past is people have talked about HIV like it only happens in certain communities. And what we're trying to do is raise the bar and talk about HIV in the Black community, right? Because it's something that I think it's an issue for all of us. It's not about necessarily where you live, who you have sex with. We should be concerned about all of us, about our children, about our grandchildren, about our nieces, everybody who needs to know in the Black community that this is something that could be prevented. We have a lot of health issues when it comes to Black people. And you know this probably better than most folks because you guys do Black Health Matters. And we know when it comes to the impact in the Black community, so many diseases impact us at a higher rate. HIV can be prevented. And that's what the message is here, is that let's take a look at HIV as a whole. You know, those of us who have children, we have cousins, everybody should know that HIV can be prevented. And we can only do that if we engage the whole community. And I think by this relationship and this partnership with Devaughn, we are able to, Devaughn Raheem, we are able to educate a wide host of people.
Yeah. Raheem Devaughn, say that again.
Raheem Devaughn, with Raheem Devaughn. We are able to, I just started listening to his music last night. Raheem
Yeah.
Devaughn. Yeah.
Right. And what's great is that he's really passionate and excited about, this partnership and working with this, and that he's got a record of working, with the community and working in HIV prevention and in the community. It's not like this is something that's new to him. He's already
No. Yeah, and that's the beauty of it, right? The beauty of it is that this is part of who he is
right.
and his commitment to the work and to Black people. So I think that's the beautiful part of this. This is not something he's doing as a one-off or a one-time only thing. So the commitment, the partnership, and the messages are all about the Black community.
Mhm. You know, are we are we paying enough attention to HIV as Black women?
No, I think, no, we're not. The answer is no.
Right.
Why? I think a lot of people think HIV is something of the past.
Mhm.
When you think about HIV kind of hit the news in the early 80s, the 1980s, and now we're in 2024. There are some young people who don't have or don't know the history that you and I lived through of people who were diagnosed with HIV, who are no longer here, all the Black artists, all the Black people who have died from HIV that they don't know about. I mean, I have some nieces and nephews who were born in 2000s, and they talk about the old days and 1990 is the old days
Right.
for them. And so I think they think about HIV as something that happened in the old days, as opposed to HIV is still here. HIV still impacts Black people more than um, uh, Black and brown people, I should say, more than others. I mean, I think that when you think about how the LGBTQ white community rallied around HIV, it became a real cause, it became a political movement for them. And now you look at their numbers are way down compared to where our numbers are. But I think for a long time, Black people thought it was something that we didn't have to worry about. And Black people have been dying since the very beginning
I
of
know.
this pandemic of HIV. And we continue to. And I think one of the reasons that it happens is we think it's happening somewhere else, as opposed to, no, it's happening to Black people. And that's what we need to make sure we bring to the forefront.
I think the death of Idea Broadbent is an opportunity to remind us that
Yes.
it is in our community and that her life and death is an opportunity for us to remember and to remain vigilant.
I agree with you 100%. I mean, I met Hadia when she was a little girl, right? And
Right.
that's another thing to think about. There are children who were born to mothers who were HIV positive before we knew how to prevent transmission from mother to baby. Now we
Mhm.
know if a woman is pregnant, she should be tested for HIV. That's just part of their regular prenatal care. There's a whole generation of children like Hadia, I think they call themselves dandelions now, who were born to mothers who were HIV positive before we understood the transmission of the virus from mother to baby. And again, that was another one of those. If you treat the virus, you lower the viral load in someone's blood, then they can't transmit the virus. That's what we learned about pregnant women. If you treat the mother, there's no virus to transmit. But you're right, Hadia, it was a living example for us in the Black community to think about how it has impacted our community, many children at birth.
Right. So it's like this is National Minority Health Month. So like this is a perfect example of us like not just saying, oh, this was a sad thing, but like take action and do something.
Right.
So
Exactly.
so,
Yes,
so
exactly.
this program is an opportunity to do just that. So thank you
Yeah.
so
I
much for this
yeah.
partnership.
Yeah, no, it is. I mean, this concerts are all over the country and everywhere that they're going, they're talking about it. And I think that
Yeah,
that's an important message. And I think that we have to just get Black people to understand that know what your HIV status is. I think of it like no, you know your blood type. A lot of people don't know their blood types even still, right?
right,
But how about finding out what your HIV status is? Because if you're having sex and you don't know, then that can put you at risk. So you
right.
don't even know what your starting point is. So it's a good reminder that it's an issue in the Black community. It can be treated and it can be prevented, but it can't be any of those things if you don't know what your status is.
Absolutely. Absolutely.
Yeah. Yeah. Yeah.
Right.
Yeah.
Thank you so much. This is a great program.
It's a great program. Thank you for having us and thank you for helping to spread the word. We appreciate it. And we have some more concerts to go. So looking
Yes.
forward to it.